So far in our conversation, you've mentioned three main challenges that you've been facing. The first being a high patient influx, not allowing you to treat as many patients as you would like to. The second being a 15% complication rate when performing those neurosurgical mass extractions. And the last being some negative feedback and reviews of patient comfort while in the surgeries. Is there anything that I'm missing there, Dr. Lang? No. I know that I have a great product for you here today in the Elekta Advantage stereotactic system. Now, the implementation of this product will enable you to tackle all of those challenges that you've been facing with its surgical certainty, powerful simplicity, and high patient confidence. I'd like to begin today talking about that first point that you made of the high patient influx and the lack of space that you're experiencing within your hospital. You've seen that recovery takes around 2 weeks normally for patients that are recovering from those neurosurgical mass extractions. With the LVSS, you will see that recovery time go down from 2 weeks all the way down to 3 to 4 days. Now, this is all possible with the LVSS device. In the surgery, you will make a smaller incision into the skull. You will have a perfect plan and path to the mass to extract it, as well as instead of using metal screws, you will use plastic pegs to keep the patient secure and in place for the surgery. Now, all of this is allowing the patient to heal quicker. The smaller incision in the skull, the perfect path, not hitting anything that they shouldn't, as well as the plastic screws that don't actually make incisions in the skin, allows the patient to be out of that hospital within 3 to 4 days, ultimately allowing you to treat your patients more effectively and allowing you to treat more patients. Next, I want to talk about the 15% complication rate that you've been experiencing. You said that you're performing around 110 surgeries annually, and a 15% complication rate shows that in 16 or 17 of those surgeries, you are experiencing complications. And with that, any complication in surgery brings about a $30,000 cost to your department. So on an annual basis, you're spending $412,500. Now, with the LVSS Center of Arc principle, you will be able to make measurements down to the nearest submillimeter and plan a perfect path to the mass to take it out, eliminating almost all chances of complications, taking that 15% complication rate all the way down to less than 1%, and taking away that $412,500 cost that your department could be allocating to different places. Not only are you eliminating that cost, you're easing the minds of the patients and the patients' families. I want you to imagine, I'm sure this happened in your career before, you're in surgery and a patient is experiencing complications. You then have to exit the room and go out to the waiting room to tell a panicking parent, sibling, family member that their brother, sister, mother, grandmother, grandfather are experiencing complications. And I know that you never want to do that. You always want your patients and patient families to have ease of mind. And with the LVSS, you will rarely be in that situation with the accuracy and precision that it provides. Next, I'd like to talk about the patient comfort that you've been experiencing some bad reviews in. Now, it's always our top priority to make sure that the patients are as comfortable as possible, especially in a surgery where they are awake, they have their brain open. It's an uncomfortable situation, and we want to make sure that we can provide as much comfort as possible. You said that you're usually performing that surgery in 6 to 8 hours. Now, with our device, you'll see that surgery time reduced down to 2 hours. And this comes from the smaller incision, perfect plan, exact route of attack for extracting the mass. As well as you will see that we have a new open face design, which allows the patient to have full visuals of the room. They're still able to access their senses. They won't feel claustrophobic or uncomfortable because there is somebody around them. They can see what's going on, and it'll ease their mind. So overall with this product, you'll see reduced patient recovery time, allowing you to treat your patients more effectively, as well as treating a higher number of patients. You also see a lower complication rate, which will eliminate that $412,000 cost, as well as ease the mind of those patients and patients' families. And lastly, you'll see a higher patient comfort level with the shorter treatment time, as well as the new open face design. What are your questions?
That was bomb.
That's good.
I don't think I messed up.
You didn't. We're gonna get gypped on